Hi, Mark Manning here with Medical Management Services in Columbus, Georgia. Let's talk for just a few minutes about LCDs, LCAs, and other medical policies as they apply to anesthesia billing. Now, most of us are familiar with the fact that LCD stands for Local Coverage Determination. Those are published by your local Medicare carrier. LCA is the local coverage article that corresponds with any specific LCD that Medicare has published. But then there are many other medical policies that are published and applied by non-Medicare or non-government payers. These could include policies published by Aetna, Anthem Blue Cross Blue Shield, or whichever Blue Cross Blue Shield you deal with in your state or your market. You've got Cigna, Humana, UHC, perhaps other commercial payers or Medicare and Medicaid CMO plans that you see in your particular market. So it's important to be familiar with these. Just a few areas that might be applicable as far as anesthesia goes are anesthesia for pacemaker implants, ECTs, dental services. You also have, in the last few years, many policies have been published as regards to anesthesia services for upper and lower endoscopy services, especially such as preventive colonoscopies. A specific modifier came out not too long ago just for that. You also have monitored anesthesia care. You need to be familiar with the policies that make sure your MAC anesthesia, your monitored anesthesia care, meets that criteria. And then a hot topic in recent years has been anesthesia provided for interventional pain management procedures. We've seen more and more pain management groups get into wanting anesthesia services provided at their surgical centers or ASCs. Or if they do procedures at traditional outpatient hospital, they're wanting to see anesthesia provided for their interventional pain management procedures. Now, it can be profitable and it can be a revenue enhancement area, but it's got to be done right. You can't just bill it and they will pay. It doesn't work that easily. So we'll discuss this in more detail in a future video. So we see a lot of anesthesia groups when we start working with them. They're coders and billers. They're not familiar at all with what an LCD or LCA is. Or maybe they have their LCDs that they are familiar with on file, but they think it applies to all the insurance payers. Well, see, that can be a big mistake because actually your non-Medicare payers, the Cignas I mentioned, UHC, Aetna, etc., Blue Cross Blue Shield, a lot of times, if not always, their medical policy is actually more extensive than what Medicare has published. So it's important that you research any and all medical policies that apply to any anesthesia services that your group is providing. But it's equally important to educate and train your providers, coders, billers, your AR follow-up team with all of these policies. But remember too, simply coding a service to meet the criteria of an LCD or a medical policy to get it paid, that's not good enough because a payer can giveth and a payer can taketh away in a post-payment review when it comes to monies that they have paid you. You've got to make sure your providers also are aware and trained, your coders, the documentation, that's the key. The documentation must also meet the criteria of these policies because that's what's going to be looked at in a post-payment review. So don't code it just to get it paid. Make sure you document also your pre-anesthesia evaluation, your anesthesia record itself, any other applicable medical records that the documentation can go in. So, as I mentioned in a future video, we're going to discuss this in more detail. We're also going to discuss in detail the surgeon side, how LCDs, LCAs, and medical policies can affect the surgeon's reimbursement. So that's important as well. So anything we can do to help your group or facility, please give me a call, Mark Manning, at 706-315-4660. Thanks, and everybody have a great day.